Thank you, Mr. Jhagड़ा. You're right now handling the finance and the health portfolio of a province, which has seen blowback in the war on terror, which has seen militant insurgencies over the course of the years. How does that inform your policy decisions, and how have they impacted the people of KPK?
Look, I can tell you the following. My consulting background, and I think my private sector background, helped a hell of a lot, right? For example, in terms of just generally working away from government, what was immediately obvious is how archaic some public sector processes are, on recruitment, on sort of approval of decision making, on the lack of usage of technology. So for example, key files, and again we've just shifted to a fileless system for decision making, but we carry not even something like this. This is typically backed by another piece of paper with a cardboard leather sleeve, a sort of piece of string to tie it, which is something probably the English gave us in 1857, and it's here, sorry. Yes, I'm a James Bond fan. So, it was very clear that there are easy ways of being able to sort of transform decision making or transform specific elements of what we do, and that the impact will be great. I think the other, so it's really very little of my decision making has been impacted by the fact that Pakhtunkhwa was affected by the war on terror. I'll come to that towards the end. There are little ways, but practically in a developing country, I think there is so much impact that you can leverage in terms of service delivery, or in terms of economic or financial impact, right? That you just do by changing simple things. That's what I learned working with the public sector while at the firm, and I built on that. So there are simple ideas. For example, the story of how health insurance came about. This was originally a project started by the German aid agency, and what they'd done was started in 4 districts out of 36 in the province for people below the poverty line. So it was a drop in the ocean, right? And then our previous government expanded it to all districts and people below the poverty line, so had about 20% of the population covered. And that process had taken 3 or 4 years. And there was no sort of ambition to really expand it. I didn't have charge of the health ministry at the time, but we were having a pre-budget meeting with the chief minister. I was sitting there as the finance minister, and the health minister and the health secretary came. And in a developing country, I think there is so much impact that you can leverage in terms of service delivery, or in terms of economic or financial impact, right? That you just do by changing simple things. That's what I learned working with the public sector while at the firm, and I built on that. So there are simple ideas. For example, the story of how health insurance came about. This was originally a project started by the German aid agency, and what they'd done was started in 4 districts out of 36 in the province for people below the poverty line. So it was a drop in the ocean, right? And then our previous government expanded it to all districts and people below the poverty line, so had about 20% of the population covered. And that process had taken 3 or 4 years. And there was no sort of ambition to really expand it. I didn't have charge of the health ministry at the time, but we were having a pre-budget meeting with the chief minister. I was sitting there as the finance minister, and the health minister and the health secretary came. And said, we had committed that we will take this from 20 to 30% of the population, but to take it to a greater proportion of the population, we need a new poverty survey because the data is poor. And the poverty survey costs 10 billion rupees. So we've come to ask for 10 billion rupees in the next budget for a poverty survey. Now, it was literally one of those things that you learn in consulting where you end up doing mental arithmetic and, take 80-20 decisions. You do that in business all the time as well, right? So looking at it, they were using 3 billion rupees a year. And they were asking for 10 billion rupees to end up using 4 billion rupees. And I was just thinking, I think for 10 billion, we can basically cover the entire population, right? So why don't we sort of get rid of all of this? Because it's never going to happen. And because I felt that if we covered the entire population, we'd sort of get rid of the sort of transaction cost of selection. You spend a few months here and you realize that it's not only just the poor in Pakistan who need access to insurance. I mean, not just the middle class, but even the upper middle class. If you have a catastrophic healthcare cost, you end up having to sell land, your house, a car, something or the other, because the insurance industry is ill-developed, right? Said, hell, let's just do it. And so that was what we decided it on. It was literally, I should write a book about this someday. What is interesting is all our development partners, the World Banks of the world, the DFIDs of the world, all come to you and say, if you want to improve your health system, start by working on primary health care, right? And work on these small units in these villages. And it's fine in a book, but it doesn't really work. And you should be, I think what you learn is you've got to be bold in decisions and take big decisions and have them thought out, but you can't, to use another firm term, it's a nice term in itself, you can't boil the ocean before you take decisions. And interestingly, what government typically does, what government in developing countries typically does, in terms of accessing external help, they access the development sector, which I think typically consists, with due apologies, I'm sure, of outstanding people, but a lot of do-gooders, right, who don't have exposure to sort of really exposure of the sort or ambition of the sort that they can really make a difference. So that's one. The other thing that government typically does is take on academics to advise them. Now, again, with due apologies, most academics, right, don't ever exit the sort of confines of the institution they're working for. It's very, a lot of the smartest Pakistanis working in the smartest, in the best universities in the States, sorry, let me correct myself. Some of them who make a career of advising government in Pakistan will come and tell you, don't do this until you've done a randomized control trial for 5 years to know whether people with insurance are better or people without insurance are better. Like, you don't understand. In 5 years, I won't be there in the job. There'll be another election, and people can't wait for 5 years, right? It's fine to make mistakes, but you've got to sort of cut it. The insurance is another good example, where the classic way the bureaucracy, pension, the classic way the bureaucracies got away with not transitioning to a funded pension plan is by saying, let's do an actuarial study to figure out. I didn't even know what an actuarial study really was, so I asked, right? So I may still be wrong, but to my simplistic mind, it's basically figuring out the NPV of what you owe today. And I actually looked at the last 20 years of data. 20 years ago, our pension bill was 1% of the budget, less than 1 billion rupees out of a 100 billion rupee budget. And now it's about 20% of the budget. And it's growing at 22, 23, 24% a year. And you don't need an actuarial study, and budgets, our budgets when you look at the historical average, and until we actually change some fundamentals in the way that we collect revenue and in our economic growth, have been growing at an average of 7% a year. Like, we've waited not solving this when we could have, right? And it's gone to really be a 20% chunk of all the money we spend. This is unsustainable. The people who are making these decisions, the civil servants making the decisions, are putting their own pensions at risk. But they won't do it because everyone wants to defer a decision to tomorrow. I didn't need an actuarial study. I didn't need a consultant, right? Just needed to take a decision. It was very clear we did the sort of work we would do at the firm, understood a little bit, realized this is the way other countries do it, and say, boom, let's move to that, right? We ended up changing pension rules. We changed the retirement age. We changed the early retirement age. We had to go back on the retirement age because the political blowback was too strong. I felt upset for a couple of weeks, but went on, and I think after introducing funded pension for all new employees, it's in the next 2-3 years, the logical step is we'll find a way to transition existing employees to it. First voluntarily and then involuntarily. And I think the impact on our fiscal space will be huge because, I don't need to tell you guys if our outlay is growing at 7% a year. Pensions are our single largest cost, and they already form 20% of our recurrent spend, right? It's ridiculous that no one's done anything about this for the last 25 years, when the world was shifting. So, to go back to the first question, I have so much space where I can make a difference. The few areas where my space is more constricted or not matters less, right? We've gone on the biggest sort of outsourcing of public hospitals program in KP. We have got 20 hospitals outsourced out of a total of 120, 130 that we have. We are advertising another 58. Now, the global literature on outsourcing hospitals is mixed, but you look at the evidence, you look at your own system, you look at what you think will make a difference, and you move. When I look at the hospitals we've outsourced and the way that we've managed them, and when I look at the challenges we have in the public sector system of sending doctors who are career civil servants to the periphery, it's almost impossible to do so, right? So when I have a model where those hospitals are still public sector, but run by the private sector, A, I've solved the pension issue for about 50,000 employees. B, it is very clear to me that the accountability will be a lot greater. I don't need to do a randomized control trial to see when I've got about a 50% gap in HR and about 10,000 out of 18,000 hospital beds not working, to be able to take a big decision and try and transform that system based on the results that we see. And so there's tons of examples like this. To go to the difference, to go to your question of where does KP being a war on terror affected province influence that? The reason I'm sitting before people like you is I want to show you we're not all people with Kalashnikov slung around our arms just looking to kill every other person that they see, right? And I think any part of the world that you actually go to that is misunderstood, if you actually go and see, if we tended to understand the parts of the world that we tend to just misconstrue from our biased lens, we'd look at it very differently. I do that with businesses in Pakistan. I did that by representing KP to at the expo in Dubai earlier this year. I did it before COVID by going to the World Economic Forum. You want to be, if you feel that you have something to offer, something to sell in a community that is willing to buy it, to be able to again play that role for the region or the country that you represent. I try and do that for Pakistan as well, right? And I won't be saying just because there's a federal government, I don't like that the rest of Pakistan is bad. I think this is still a country with a great future. But I think, I honestly feel that my province has a huge amount of potential. And if you'd ask me again when I joined politics, right, if I would start off by sort of being involved in politics in the province versus the center, I actually feel I have more impact I can make there, because Pakistan is a federation with a lot of devolved powers, and I use the health insurance example to actually prove that that's the right way. If we had more of a unitary form of government, I can promise you health insurance would never have happened, because everyone would be looking at everyone else and say, we've got to develop consensus, which is what the public sector and the development sector love to do when they don't want to take a decision. Say, we've got to develop a consensus.